Hi everyone, my name is Amber Kim, and my disease presentation is on Ehlers-Danlos syndrome, EDS for short. So, what is Ehlers-Danlos syndrome? EDS constitutes a group of genetic disorders that impact the connective tissues supporting various bodily structures, such as the skin, bones, blood vessels, and numerous organs. As stated in the National Library of Medicine regarding EDS, this broad systemic involvement can lead to considerable morbidity and mortality, with complications ranging from arterial and organ ruptures to joint dislocation, chronic pain, and fatigue. So this slide here is just showing some signs of EDS. So it does state at the top here again, it is a genetic connective tissue disorder that affect the skin, joints, and blood vessel walls. So usually people with EDS can bend their elbow backwards beyond 10 degrees, so that hypermobility, hyperextension. They do have a weakened connective tissue that allows the skin to stretch more than the average person. And then also their joints can move far past the normal range of motion. So some symptoms and signs of EDS, other than the ones we just went over, they are recurrent joint pain, so joint pain that usually comes back, joint hypermobility, which means loose or very flexible joints, orthostatic hypotension, which is feeling lightheaded or dizzy when changing positions quickly. They also bruise really easily and fatigue very easily as well. They are known to have soft skin, almost kind of velvety skin and texture. They do have stretch marks. A lot of times these stretch marks are found in places that aren't normal, like in their elbows, inner thighs, places like that. And then also they do have a high and narrow roof of the mouth, so the palate, as you can see in one of those photos down there on the bottom right-hand corner. They also usually do have IBS, which is irritable bowel syndrome, a disorder that causes gas, belly pain, diarrhea, and constipation. They also do have fatty lumps around the knees or elbows, and lastly, certain characteristics like a thin nose, thin upper lip, small earlobes, prominent eyes, and transparent skin. So, EDS can be transmitted through dominant or recessive genetic patterns, where human traits result from the interaction of two genes received from the father and mother. The dominant genetic disorders, they usually manifest when a single abnormal gene copy is sufficient to cause the disease, and it can be inherited from either parent or arise as a new mutation in the affected individual. The likelihood of passing the abnormal gene to an offspring from an affected parent is usually 50% per pregnancy, with equal risk for both males and females. There are some cases that result from spontaneous genetic mutation, also known as de novo. This happens when the egg or the sperm cell goes through, again, a spontaneous genetic mutation and is not inherited from either parent. Recessive genetic disorders occur when an individual inherits two abnormal gene copies for the same trait, one from each parent. If one normal gene and one disease gene are inherited, the person becomes a carrier without showing symptoms. So it is possible to have EDS without having those symptoms of like that velvety skin, hypermobility, high palate. The risk of both carrier parents passing the altered gene and having an affected child is 25% per pregnancy. The risk of having a child who is a carrier like the parents is 50%, while the chance to receive normal genes from both parents is 25%, again with equal risk for both males and females. So over here on the right side in white, these are some examples of genes that provide instructions or encode on the synthesis of different subtypes of collagen. So there's COL1A2, COL1A3, COL5A1, COL5A2. Other genes like ADAMTS2, PLOD1, and TNXB are responsible for encoding the proteins that are associated with processing collagen or otherwise interacting with collagen. Defects in these genes have been associated with different types of EDS subtypes. We will go over those in the next slide and the slides to follow. Diagnosing Ehlers-Danlos syndrome is a little tricky. It primarily relies on clinical assessment, but pinpointing the specific collagen-related gene is very crucial for type identification, guiding management, and counseling. Genetic testing typically is done via a blood test and is used for rare forms of EDS. The 2017 International Classification proposed 13 variants categorizing EDS into 6 types. So those 6 types are classical, vascular, hypermobile, arthrochalasia, kyphoscoliotic, and dermatosparaxis. Joint hypermobility can manifest as asymptomatic hypermobility, EDS, or hypermobility spectrum disorders, leading to complications like chronic pain, dysautonomia, gastrointestinal dysmotility, mast cell activation, and anxiety. Advances in variant identification highlight the needs for clinical recognition, especially for life-threatening complications associated with specific EDS variants, such as the vascular type. So going over these 6 types of EDS or 6 subtypes of EDS, next to them, I have some of the genes that are associated with them. So just going over it really quickly, the classical subtype is associated with organ fragility. And the genes typically involved with that is COL5A1 and COL5A2. These two encode the protein pro-alpha 1,5 chain and pro-alpha 2,5 chain. The prefix pro indicates that their final product must be acted on by an enzyme, which activates the final structure. Procollagen is a product of 3 chain-like proteins. Secondly, we have that vascular subtype. So that gene is COL3A1. This is a severe type of the condition that can cause walls of the blood vessels, intestines, and uterus to rupture. This gene encodes pro-alpha 1,3 chain, and 3 of these products associate to form type 3 procollagen. Next, we have hypermobile. It is the most common, and the symptoms are loose joints and chronic joint pain. So the gene associated with this is TNXB. A small group of individuals with this type of EDS have been found to have deficiency in tenascin X, which is a protein that is encoded by the gene TNXB. Product of this gene is found outside of the cell and is important in maintaining the integrity of the scaffold in which the collagen lies down. The fourth one here is arthrochalasia. It is a rare type of condition where patients have congenital hip dislocation. The genes affected here are COL1A1 or COL1A2, so not both, either or. COL1A1 encodes the pro-alpha 1 chain, whereas the COL1A2 encodes the pro-alpha 2 1 chain. Last two here, kyphoscoliosis or kyphoscoliotic. So it is a rare type that affects the individual spine. The genes affected here are PLOD1 or FKBP14. PLOD1 mutations cause reduced activity in the enzyme lysyl hydroxylase. This leads to a deficiency in hydrolysine production. Hydrolysine is crucial for forming cross-links in collagen chains, so keeping them together. And then the FKBP14 gene encodes FK506 binding protein 14, whose function in the cell is not well defined. Lastly, dermatosparaxis, again, a rare type. Individuals usually have severe skin fragility and are easy to bruise. The gene affected here is ADAMTS2. The enzyme encoded by this gene modifies collagen products, removing short amino acid chains from pro-collagen molecules to produce mature collagen. It is said that anywhere from 1 in 5,000 to 1 in 200,000 individuals are affected by any of these 6 types of EDS. Let's test your knowledge. So, checkpoint 1 here. Which of the following is or are not symptoms and signs of EDS? Please select all that apply. I will give you a few seconds here, but feel free to pause. Alrighty, moving on here. If you look down in that right-hand corner, our answer is down here. So the answers are C and D. Itchy and irritated skin and muscle soreness are not symptoms of EDS or signs of EDS. Usually it's soft and stretchy skin or reoccurring joint pain. So, treatment and prevention. Managing EDS requires a multidisciplinary approach to prevent the disease progression and complications, as there is no real cure. Specialists oversee specific care based on the patient's pathology, with the cardiologist addressing cardiovascular concerns, an orthopedist managing musculoskeletal issues, and a geneticist or a family medicine provider serving as the primary referring provider. Certain treatments or prevention methods are medication. So, over the counter pain relievers like Tylenol, ibuprofen, which is Advil, Motrin, and naproxen sodium, which is known as Aleve. Or if those do not work, they can be prescribed a stronger medication for acute injuries. Physical therapy is a great way to prevent any injuries for those people who have hypermobile joints. Physical therapy will not only strengthen the muscles, but also stabilize the muscles around the individual's joints, since it is easy for them to dislocate because of the connective tissue being so weak. And lastly, here, surgery may be recommended if there is a sufficient damage to the joints due to multiple repetitive dislocations or to repair blood vessels and organs that might have ruptured. The only issue here is that with surgery, the skin is stretchy and fragile in individuals with EDS, so the individual may have issues healing the wound. So continuing on with treatment and prevention here. Again, just to reiterate, unfortunately, EDS is not something an individual can completely prevent since it is usually passed down by a parent. If either parent has EDS, again, the child is likely to have a 50% chance. A few other prevention methods here is to keep their stress level down to prevent high blood pressure, to prevent a stroke from taking place. Some things they can also do at home to prevent injuries are to choose sports carefully. So, no heavy weightlifting or other activities that raise the risk of injury. So, things like walking, swimming, biking are all usually good. Resting your jaw. Avoid chewing gum, ice, the jaw, and if you're at the dentist, make sure to take breaks because, again, people with EDS are very hypermobile and their jaw can dislocate. Wearing supportive shoes is important as well for those people who have joint pain. And then lastly, improving sleep by sleeping on the side or having a dense foam mattress to provide maximum amount of support. So how does EDS tie into cell and molecular biology? Other than the 9 genes I have previously mentioned in the first few slides here, there are many other genes that have been found to cause EDS. On this slide, I have provided an additional 12 genes, and we will go over the importance of each gene here. So starting on the left-hand side, under that white bubble here, ZNF469 is also known as the zinc finger protein 469. It acts as a DNA transcription factor or an additional nuclear regulator for collagen fiber synthesis and organization. This genetic mutation is caused type 1 BCS, or also known as brittle cornea syndrome. PRDM5. This gene's encoded protein functions as a transcription factor belonging to the PR domain protein family. It features PR domain and multiple zinc finger motifs. PR domain family transcription factors are recognized for their roles in cell differentiation and tumor regenesis. SLC39A13 is responsible for the transportation of zinc into the cell. It encodes the protein product solute carrier family 39, member 13. Zinc is important to those who have EDS because it is essential to the healthy function of connective tissues. B4GALT6 and B4GALT7 genes are within the family that is associated with the synthesis of different glycosylated and saccharide structures. CHST14 is involved in multiple chemical reactions involving the transfer of sulfate groups between different molecules and encodes the enzyme carbohydrate sulfuryltransferase 14. Moving on to this pink bubble here on the right side, DSE is dermatan sulfate epimerase and is important in the production of dermatan sulfate, aka chondroitin sulfate B, a glycosaminoglycan. Glycosaminoglycan is important in filling the gaps between connective tissue. This allows the tissues to be cohesive and also provides stability. COL12A1 gene encodes the type 12 collagen. It's usually linked with type 1 collagen and is believed to alter the interactions it engages in. Last few here, C1R and C1S are genes that encode complement subcomponents crucial for immune function. And lastly, FLNA contains the genetic information for synthesizing filamin A protein, contributing to the formation of the cytoskeleton and intricate internal network of protein filaments within the cell. Here are my references. And lastly, Ehlers-Danlos syndrome encompasses a group of hereditary connective tissue disorders characterized by clinical manifestations such as skin hyperelasticity, joint hypermobility, atrophic scarring, and fragile blood vessels. Recognizing and diagnosing EDS accurately is crucial for enhancing the overall health and well-being of affected individuals and for managing potential complications. Thank you.